Hey guys, Don here. Welcome to Podiatry Practice Mastery. We're helping you get to the $1 million mark and beyond. I'm going to go over my day. This is a recording for a Friday. And so this is the day that I have Marjorie, who is my nail tech, helping me. So in our office, each of the doctors do a half day of nail care per week. We try to put everything in that time. So mine was Friday mornings. Another kind of a good thing I think I've told you about, I've been dealing a little bit with my dad with dementia. Recently I was able to switch his insurance over. It's actually easier than I thought. It's a Blue Cross Blue Shield Advantage plan. And it's funny, as I was finishing this, I'm like, okay, where do I give you his credit card? I said, well, it's $0 per month, so there's no need for a credit card. And I was like, that's great, something that's free. But I think he still pays his like Medicare premium and stuff like that. But so happy about that, making advancement. I'll let you know when he goes to his first adult daycare. I know it's kind of heart wrenching here to work on this for my dad, but hoping to have a good holiday weekend first, and then see how that goes. And also next week we're going live for ModMed, and I will let you know all the struggles and things that go along with that. Okay, so morning was a lot of routine. So every 10 minutes, so there were 37 patients total. Probably 27 were from the morning. There's a couple of diabetic foot exams. The main thing of note was there was a patient that needed bilateral KeryFlex. Those really take me a while to do a good job, and I'm training Marjorie how to do that. So she did those. She needed a little help grinding the nails down really kind of thin to not make it elevated. But other than that, she did a good job. I think that they look good when she's doing them, better than mine. And they take a long time, so I'm glad that she's doing them now for us. I'm also teaching her how to do calluses. So basically calluses she's doing under my observance and watching her do them. And she's getting better at them, just not being, I guess, as aggressive. And I think we were all the same when we started doing calluses. Okay, so the afternoon, there were, like I said, about 10 patients. So the first one was a Lamisil follow-up. So this patient was a Lamisil booster. Then I debrided her nails. She also had a little bit of right kind of sinus tarsi / ankle pain, and I did a 3 cc injection of cortisone in the kind of the sinus tarsi region for her. I'm going to see her back as needed. I also got I don't know. No, that was just the level of visit. Okay. Next one was a 62-year-old female. She came back. She had a normal sample on her toenails. So once again, I'm not doing a ton of nail samples. If I'm unsure to put people on Lamisil, I'll do a nail sample. Hers came back normal. But then as she was telling me, I did it of the hallux, and she had a couple of other nails that were thickened, and she would still want to be on the terbinafine. So I gave her Lamisil number 1, and she got the Lamisil kit. So just a reminder, the kit comes with a UV light, a shoe spray, and 2 bottles of biotin, and then she's got the terbinafine. So it's the medication management, so level 4 office visit, along with those other things. Next patient was a new patient, office visit for an annual foot check, so they got a diabetic foot exam, and we did the nails. Next was a new patient, had calluses bilaterally that I trimmed down, really kind of deep fissures to the heel, so I recommended my little kit, which includes, in the morning they do 42% urea cream, and in the evening they do the sleep socks and then pumice occasionally. And then she also had one of the calluses was really deep, so I called it wart / IPK, and I did lesion destruction on that. Next patient was a Qutenza. This was Qutenza number 4, and he's saying that he has improvement for the first couple of months, and then some of the neuropathy feelings come back, so that's why we're doing the Qutenza on him. I kind of feel like Qutenza I could almost start double booking if I had enough rooms, because it doesn't take me that long to check how they're doing, and the staff does most of it. They basically, when I put the Qutenza on, then I put a timer out for 15 minutes, and they check the vitals, and then do another 15 minutes, and then they take it off. Next patient was a patient that had a nails and a callus and had some pain, and I took care of that. It was actually a fifth toe rubbing against the fourth toe. Had a kind of a thickened nail and some callus in there. I trimmed all that for them. Next patient was a wart patient that I did lesion destruction on that wart. Next patient was this was a patient that was in there twice. I'm just noticing the same patient was in there twice. She had 2 appointments for some reason. and she ended up doing Aldera, and so the medication management, and she did number 1 of Swift. Now I'm getting pretty good with this Swift presentation, meaning most patients that I do the actual PowerPoint presentation for them or the Google Slides, they're opting for Swift. And I think the main reason is there's less visits, and even though it's a little more painful, I think in the long run it's going to be less expensive. So she tolerated it okay. She only had 1 lesion, so it's a little bit easier than the ones that have multiple lesions. Next patient was a 38-year-old that had pain to the posterior tibial tendon. He had number 2 out of 3 for the shockwaves. And then the next patient, I usually do 6. I don't know why he only got 3, but he only had 3. He only has 1 more set up. And then this other patient was a 16-year-old. She had originally an ankle sprain on the right. I got repeat x-rays. She has anterior lateral ankle pain. I recommended doing a cortisone injection, but she declined. I recommended physical therapy. She declined. She just wanted to go back to doing gymnastics. And then the last patient was that wart one. So it was a good day. In the office, it was very busy with Marjorie. And the way I kind of do it is Marjorie, she goes first. She starts seeing the patients. Then I just pop in there, and then I do the note. And my scribe works really, really busy, kind of doing all these notes because there's a lot of notes. So we'll see how this goes. I'm a little tentative next week about switching to ModMed, only because I know it's going to be hard. I remember when we switched to Athena, and like the first 6 months it was horrible. Not horrible, but it was really hard just because all the patients are new patients. We have to learn how to use the medical record and how to get the billing up and how to put our templates in there and things like that, and as well see patients. So we did block out, froze some spots. So I think like every 2 patients we froze 1 so we can have a little bit more time to go over it, and the trainers that are coming in the office. So I will let you know how that goes. I want to tell you something else. There's another colleague of mine, Lonnie, and he was part of my WhatsApp group master, like my WhatsApp group for a while. And he said he has had some good success with a website that's like it's called DoctoGrow, DoctoGrow, and I guess I don't know if they do his website and everything, but they have this kind of new AI phone attendant that'll ask their information and give them information about the clinic. So it kind of simplifies things with your practice versus having your staff do all this. It'll make appointments, it'll give them information, and specifically he's opening up a second office, and there's a lot of interest on that office, but because he put out a Google My Business location because he's renovating it, but he's not able to see patients there. So they're offered an appointment at his current office, but then they're also added to an email list. So when people give them his information, he's adding them already. So this is just kind of an idea. If you're thinking about opening a practice or opening a second office, you can actually put out your Google My Business location first if you're renovating and getting prepared, and then find a way to capture email. So when people call, have them go to this virtual attendant, they'll get their email name, and then when you are ready to start, you can start marketing and emailing to them. So anyway, those are the thoughts from today. Once again, if you have any ideas, shoot me an email, Don at Podiatry Practice Mastery. I would like to hear from you. Until next time.